Greetings, my name is Carmen Chalupiak and welcome to my NURS 821 policy pitch. Illegal drugs and problematic drug or substance use are not new in Canada. However, the opioid crisis has brought to light the devastating effects opioids are having on individuals, families, and communities across this country. While we have been talking about the opioid crisis for years, pregnant women who struggle with addiction and the outcomes this has on their newborns seldom make it to the top of the priority list. Health care for this vulnerable group is disjointed, and infants are receiving variable care and not getting connected to the services they need. This is a substantial public health problem that is still lacking solutions. There is evidence that the COVID-19 pandemic has further worsened outcomes, as there was a 71% increase in opioid-related deaths in 2020 compared to 2019 in Canada alone. I am asking for your consideration to help refocus resources into addressing these issues by furthering research to determine how best we can help this vulnerable cohort. We need to establish better accessibility, models of care, support for healthcare providers working in this area, as well as best evidence-based practices surrounding medication administration to treat misuse. According to the Centre for Disease Control and Prevention, the most current estimate available reports that the number of women with opioid-dependent related diagnoses documented at delivery increased by 131% between 2010 and 2017. The Canadian Substance Use Costs and Harms Working Group estimated that opioid use cost Canadians over $5.9 billion in 2017. While the opioid crisis has affected every region in Canada, Western Canada, including Saskatchewan and the Northern Territories, have experienced the highest burden. Opioids are substances with pain-relieving properties and can refer to both prescription medications and illicit street drugs such as fentanyl and heroin. Regardless of why they are consumed, they can cause harm. Individuals can experience long-term adverse health outcomes such as liver damage, increased tolerance, worsening pain, or withdrawal symptoms, among others. When taken in pregnancy, these consequences can transfer to the fetus. Some risks to the fetus include intrauterine growth restriction, congenital birth defects, preterm birth, and neonatal opioid withdrawal syndrome. The World Health Organization recommends the use of a range of treatment options for opioid dependence in pregnancy. These include using an opioid agonist treatment such as methadone and buprenorphine, which has the strongest evidence of cost effectiveness, as well as psychological treatment and support. Universal screening should rely on validated screening tools. The top priorities need to start with focusing on increasing accessibility to care, decreasing stigma of healthcare providers, as well as providing education on harm reduction strategies and best practice guidelines for individualized, evidence-based care. The bottom line is the government needs to do more to help the opioid crisis. It is not a criminal matter, it is a health matter. It is clear that if more action is not taken, lives will continue to be impacted and lost, with generations of children that grow up with deficits due to prenatal drug abuse. Thank you.